We're going to start out with some polling questions related to topic one. Once we're finished with those, then we will turn to our audience discussion. So if we can go to the polling questions. So again, this is going to be for individuals with lupus and their representatives responding on behalf of the person they're representing with lupus. So our first question is, of all the symptoms you have experienced because of lupus, which do you consider to have the most significant impact on your daily life? So here we're asking you to pick those that have the greatest impact, and please select your top three. So if you're on the browser, you can click 3 different responses. If you're texting, you can submit 3 different letters. The options here are A, depression, B, fatigue, C, forgetfulness, D, increased susceptibility to infections, E, joint and muscle pain and or swelling, F, rashes, G, reduced physical strength, H, renal or kidney disease or kidney failure, I, organ inflammation, J, sun sensitivity, K, other symptoms not mentioned. So please pick your top 3 that have the most significant impact on your daily life. I'll give you another minute to submit your top 3 responses. All right, so while the final responses are trickling in, it looks like the overwhelming, most burdensome symptom of lupus for all of you is fatigue, followed in second, joint and muscle pain and or swelling. After that, it looks like there's quite a scattering across most of the other symptoms. Looks like those that have that are least rated as being the most burdensome are rashes or some other symptoms, although I think it's important to explore some of these other symptoms that we don't have listed. And so if you happen to be one of our others, I'll definitely encourage you to chime in during our facilitated conversation to share those with us. The next question. So this question is, some people find that their lupus makes it hard to do certain activities, so please select up to 3 activities that are most impacted by your lupus. So again, you can select here up to 3 that have activities that are most impacted, with the response options being A, attending school or work, B, performing daily hygiene, C, managing personal finances, D, being intimate with a spouse or partner, E, driving a motor vehicle, F, doing outdoor activities involving direct sunlight, G, participating in sports or social activities, H, performing household chores, I, taking care of children or others, and J, other activities that are not mentioned. So please select up to 3 activities that are most impacted by your lupus. Okay, it looks like the activity that is most impacted for our participants is attending school or work. After that, it looks like as pretty closely almost tied in second are doing outdoor activities that involve direct sunlight, participating in sports or social activities, and performing household chores. It looks like there's also big impacts on intimacy with spouse or partner, ability to perform daily hygiene, and taking care of children, and then a few of you responding to the others' impacts, as well as some that are not mentioned. Next question. So this question is a rating scale type question. So on a scale of 1 to 5, how much do your lupus symptoms negatively impact your life on your best days? So this is on your best of days. If you score a 1, it would be a minimal impact, a few limitations on daily activities. And 5 is a score of a high impact, where you're completely unable to complete basic daily activities. So again, on a 1 being minimal impact, 5 being high impact, how much do your lupus symptoms negatively impact your life on the best of days? So it looks like on the best of days, there's a range of how severely impacted you are by your lupus. It looks like most of you, or not most of you, but the highest category of daily impact is somewhere directly in the middle of low, minimal impact and high impact. It looks like we're a little bit more weighted towards the lower range of the rating scale with minimal impact or near minimal impact. But there are a number of you that have closer to a high impact, and some of you that even on the best of days have a high impact where you're completely unable to do basic daily activities. So we're definitely going to want to explore what it is that drives, which symptoms drive this impact in your lives on the best of days, and hope you'll share that during the audience discussion. Next question. So this is a similar question, except we're going to be focusing on the worst of days. So again, on a scale of 1 to 5, how much do your lupus symptoms negatively impact your life on the worst of days? Again, a score of 1 is minimal impact, having few limitations on your daily activities, whereas a 5 is a high impact, where you're completely unable to complete basic daily activities. Oh. Oh. Yeah, well, so it hasn't updated on your syncs? Okay. So it appears that on people's browsers, it has not updated the question, so people are not able to respond. Still, it did just update. Okay, so everyone, the question has now updated, so please now respond with how much your lupus symptoms negatively impact your life on the worst of days. I didn't think you guys were going to be shy all of a sudden on me, so thank you for letting me know about that. While the final responses are trickling in, I think it looks, it's very clear that for definitely the majority of you, on the worst of days, you have a high impact from the lupus symptoms that you experience, where you're completely unable to complete basic daily activities, with a second being about a quarter of you experiencing near high impact, only a few of you experiencing somewhere in the middle, and nobody reporting that they only have a minimal impact on their worst of days. Next question. And did this one update? If I can get that. Okay, excellent. So our final question on topic 1, your disease symptoms. We're interested in you selecting if your lupus is currently A, under very good control, where this might be stable with little or no flares. B, under moderate control. This might be if you have some flares, possibly requiring dose changes in current medications. Or C, not under control. This is active disease that requires treatment changes and possible hospitalization. So please self-select into how you would characterize your lupus currently. Okay, looks like the final responses are just trickling in. So it looks like just over half of you describe your lupus as currently being under moderate control, and then pretty close to 1/5 to 1/4 of you are under very good control or not under control. And so I think we'll get to explore that more in our audience discussion. So if we can switch back to the other deck. All right, so now we're going to move into our first facilitated audience discussion. This is your opportunity to build on what we've already started exploring with our panel discussion and through the polling questions to bring your voices to the conversation. And so the way that this will work is all of you that are individuals with lupus or their representatives in the audience are welcome to participate. We just ask that you raise your hand and please wait for a mic to be brought to you. I'll call on you. If you don't speak into a mic, all of our web participants won't be able to hear you, and our recording won't be able to capture you. So please wait for that mic. Please state your name and then respond to the questions that we're going to be discussing. So with that, I'd like to start by exploring the symptom which most significantly impacts your life. We heard a number from our panelists, and I'd like to hear those of you that either have something that is similar to what we've heard already, but also, especially if there's something that really is your most burdensome aspect of lupus that has not really been talked about yet. So just raise your hand and we'll first volunteer.
My name is Mary Sayas, and I'm from Houston, Texas. And the thing that has been the most aggravating is the fact that I can't open canned goods. I live alone. When I go grocery shopping, I call my son. He comes that day or the next day. He opens jars, bottles, and cans, everything I need for that week, so I don't have to deal with the struggle. I mean, I have literally gone to tears trying to open up a can of corn with those flip tops. That is the worst thing ever invented.
So what exactly is it that makes it difficult to open the can?
Strength. And the flip side of that is that I can still drive a car, but I can't open a can of corn.
Yeah.
It's things that still puzzle me about this after 26 years. How can I drive my car after that struggle? It's just mind-boggling. But that's lupus. You deal with it.
And how long ago in this 26-year struggle has it been that you haven't been able to have the hand strength to open cans?
It's been within the past 15 years or so I've noticed that particular change. And I'm going through some other changes. I haven't figured out what they are. We'll address that when I go back to the doctor again.
Sure. No, thank you for sharing that.
Oh, you're welcome.
All right. So we'll come across the front of the room to this front table here. In just 1 second, there'll be a mic momentarily. There we go.
Hi, my name is Tracy Potts, and I think the number one issue that I experience with I have discoid and SCL lupus is the fatigue. And I think we've all heard the spoon theories and the other things where you try to explain to people who don't understand why you're so tired all the time, or how you can be fine 1 minute and an hour later not be able to continue on. And I equate it to an old cell phone that you have that maybe doesn't fully charge all the way, or it charges and you take it off and it might last the whole day, or some days it only lasts half a day. That's how I feel. I feel like I never really fully recharge, and I feel like if most of us could find a solution to the fatigue, we could deal with a lot of the other symptoms that we're dealing with, because we at least are able to do things for ourselves and not feel just so debilitated by something that we have no control over. So I think the number one condition that bothers me would be the fatigue.
Yeah.
Absolutely. And then the pain would be second, and the brain fog. I think I've spoke with so many people here, and we all have the brain fog. And there are times when, email's just better because I can take my time really thinking of the words I want to use instead of trying to think in person and know that I'm not going to find the words.
So with fatigue being the top symptom that burdens you, I'd like to explore a little bit about your fatigue. You use the cell phone battery analogy. So I'm just curious, is it kind of it varies how long the charge lasts day to day, but is it a slow drain or is it all of a sudden a rapid drain?
It can be either or.
Either or.
And sometimes it is sun related, and other times I have no idea why.
Sure.
And yeah, I have, my husband and I own our own company, so I'm very fortunate. I can work from home when needed, but when I go in my office, I have a couch, and everybody knows if my door is closed, I'm napping, and that's just what I have to do.
Sure.
And I could be fine and be great all day, or have to take 2 naps that day. So I'm very fortunate in that. But yeah, the fatigue it's very severe, and there's just no end in sight. Some of the medications can help you with the other symptoms, but the fatigue is one I have not found.
Sure. Thank you so much.
Thank you.
All right. Yep, we'll come right back here first, right behind you.
Hi, my name is Robin. I'm from the San Francisco area, and I have central nervous system involvement and have had cerebritis, inflammation of the brain and of the spinal cord. And so my biggest issue is sometimes cognitive difficulties, and I think that will wax and wane, but if I'm fatigued, it's even worse. And I was a practicing RN, and my specialty was HIV. And I had to give up my profession because I was no longer able to do mathematical functions and calculate drug dosages, or I couldn't remember someone's blood pressure after I took it. Just like name finding, someone will tell me their name and a minute later I cannot remember it. Or I'll be in a conversation and lose my train of thought. And that happens frequently. If I'm more tired, it's even worse. And if I'm in a flare, I won't be able to remember conversations, that kind of thing. So it's a huge loss when you had, you felt like a fairly high intelligence level at one point, and I don't really feel like my intelligence has changed, but my ability to function and have a high level conversation, it's kind of affected my confidence in that level. Growing up with kids that are now almost grown, I got really razzed by them. They would try to trick me and say, "Oh, you didn't give me my allowance," and I do remember that, So I just feel like lupus robbed me of that, and that's very difficult to deal with. And the doctors really can't do anything for you. They gave me Provigil, which helps with my energy level. But it's a shame that they don't really have anything to help you with your cognitive functioning.
Yeah, thank you for sharing. Those were really kind of very useful and vivid examples of the different ways that it's impacted you and how it varies. So I really appreciate that.
Thank you.
Yep. And we'll just go right next to you. Keep working our way around.
Hi, my name is Omar Faruqi. I've had lupus for about 12 years. I've been through some various different stages of it. Started out with a very mild case when I was 16, and I've been through a phase with nephritis, and most recently I've been in a phase with CNS vasculitis. From 2015 to almost June of 2016, I suffered 5 strokes. The last of which had me, I just fell. I was taking my medicine, I fell on the ground, and I couldn't move my left arm or my left leg, and I think that was the one that had the biggest impact on me. Because I used to be the type of person who used to love to travel by himself. I used to ride motorcycles, I used to practice martial arts, and I'm still recovering from that really big one. I guess a point I would mention quickly that I'd like to bring up in the next panel was that because of the high-dose steroid uses that was done to help treat that, I've required 2 hip replacements, one of which I have done and one of which I have coming in November. And so it's really changed the person who I was. Like I said, I used to love to travel by myself, visit my friends in different cities, ride motorcycles, and I just don't have the confidence to do something like that anymore because I don't know if I'll be riding a bike and I'll suffer another stroke, or I'll be in an airport and I'll just, the left side of my body collapses again. So that's something I wanted to share.
Sure. And how long ago was the most recent stroke, and how far before that was the first stroke?
So my most recent stroke was at the beginning of June in 2016, and my first stroke, which was kind of undiagnosed because that was in October of 2015, and initially it was just considered a combination of like a carpal tunnel or just being on the computer too long, because I'm a web designer, so I do sit at a desk for a long period of time. So they weren't really sure if it was a neurological issue.
Sure. Thank you very much. We'll come up here.
Hi, my name is Kelly Tatum, and I'm from Boston, Massachusetts. And I was diagnosed with lupus 18 years ago, but I had suffered with all the symptoms since elementary school. I'm a divorced mom of 2, and my biggest complaint is the chronic fatigue, the medications, the side effects of the medications, which left me basically comatose through the elementary school and middle school years of my children. It's very, very difficult. Depression set in. I'm not able to go to functions. My kids have literally taken care of me because of this disease, and that's the hardest thing. 2 years ago, I was diagnosed with leukemia, and I was in intensive care for 3 weeks. I was in the hospital for 3 months. My kids literally took care of themselves while I was in and out of the hospital. I had chemo in the hospital because of the lupus. I couldn't go home. So it's been a very rough road. I've been cancer-free for 2 years, so
That's
thank
great.
God for that.
Congratulations.
Thank you. But basically, it's been my faith, my church, my sorority sisters, my family, my friends. People know that when I RSVP, my intentions are to come, but the day of the event, and I can't make it, they understand.
Is that because of the chronic fatigue that you mentioned?
Absolutely.
Yep.
Chronic fatigue, the pain. I've been in constant pain for 18 years. Some days it's less painful, but every day I am in pain.
And can you describe where the pain is, what type of pain it is?
I get it all over. I also have fibromyalgia and arthritis, so it's basically from my shoulders to my toes. It's the tingling, burning, inflammation pain.
Sure. Thank you so much for
Thank
sharing
you.
that. Okay. Keep moving this direction.
Hi, my name's Eva Ellsworth.
Hi, Eva.
I'm from this area. I'm 54, and I was diagnosed when I was 18, but I believe I've had lupus since I was about 11. And my worst symptoms are just the fatigue. I was actually written down on my last review because I fell asleep in a meeting. And the other one I have is fainting, which has been sometimes embarrassing. But the thing lupus really robbed me of was the chance to have kids. Because I had ovarian failure when I was 27. If I knew that was going to happen, I think I would have run out and found a husband and kids when I was in college. But
Yeah.
no, I had no idea that would happen. And I've always felt bad that I've never had a family. And that's my story.
Yeah. Thank you.
Hi, my name is Kelsey Schmidt. I am from Chicago. And I think my biggest complaint is robbed me part of my life. I was diagnosed with lupus, I would say probably around 4 or 5 years ago. It I was diagnosed at that same time with Sjogren's and celiac disease. So it's hard to say when I've had all those symptoms because it's been for years. It has completely changed my life. It is changing my career. I am a registered nurse. I work in pediatrics. I worry about infection on a daily basis. I worry about, because I am doing methotrexate, I am on Benlysta, I do steroids, my immune system is bad. My doctor told me, many of my doctors have told me I need to get out of my field. I've been working in hospitals for 15 years. It's very difficult to change that. My doctor has told me I have to wear a mask when I work. Again, that's not very friendly when you work with kids. I've lost friends along the way. People don't understand every time you have to cancel. People don't understand. I can't see you. Your kids are sick. I can't come around. No one truly understands what you're in bed. You can't move. You can't even put on pajamas. It's hard to go to the bathroom. People don't understand. And I don't like to see them when I'm sick. It's a vulnerability. So I do it on my own. It's deprived me of children. I'm an ovarian failure too. So for working with kids, it's very difficult. But the good thing, it has made you into a warrior. It has changed the way that you live. You make every day, you appreciate every day. It's make you stronger. So I do see the positive point of having it. But it's definitely changed. It's changed my direction of where I wanted it to be.
Sure. And there's multiple things, kind of driving some social isolation.
Yes.
That's a very important thing to share. So thank you. We'll take a hand here, and then we'll move back over.
Hello, everyone. My name is Shane Tanner. I am the husband of Laura Tanner. I do not have lupus. But my main concern is I've been with her for over 13 years, and I've seen different stages, But the fact that she can deal with me for the past 13 years has nothing to do, lupus is nothing for her. But my main fact is we're from Fort Bragg, North Carolina. I am in the Army. We know we've seen 1 million doctors. But the main fact is we live so close to Chapel Hill and Duke. These are supposed to be some of the best, and it's like we can't get in. I don't know if it's trying to get a referral, just trying to get her the answers she needs. We can't do it.
Sure.
So hopefully with all this, we get some hope out of it.
Sure.
That's all I have.
Thank you very much for sharing that. Sorry. Just seeing if I'm got the mic. Giving me the. Are we back? No. There we go. Maybe I'm not allowed to go in that corner or something. No, thank you very much for sharing that. I know there's a lot of frustrations, can be a lot of frustrations with access, but I hope we can really explore some of the burdens of the lupus itself, and hopefully that will help drive innovation, drive more options and drive more access to possible things to help. So I'd like to move back here to the center of the room. Yeah, we're still exploring things similar or different burdens that are the biggest impact on you in your daily life. So if we can go right here.
Hi, my name is Christelle. I'm from Queens, New York, and my biggest issue has been with dealing with lowered energy levels. I was diagnosed in 2007, and luckily for me, it was a pretty quick diagnosis from first symptoms to actual diagnosis. But I've had to try to deal with managing energy levels from day to day, and it's been an issue because I'm trying really hard to, as I go about my day or my weeks or whatever, to make sure I have enough energy to last me the day. But the issue is I don't really know how much I'm beginning with in the morning. So that's been my biggest issue. I've always been a person who tries to put my all into everything I do. And now I feel like it makes me feel kind of not myself to have to do it halfway, because if I don't do this thing halfway, I won't be able to do the next one at all. That's been my biggest issue. The second one is the Raynaud's, and I live in New York, and unless it's the dead of summer, I'm always cold. And summer, of course, because of the sun, is a whole other problem. But it's always been an issue for me dealing with, even in the fall, even in the spring, I'm always cold. I always need sweaters. I always need gloves. And the only reason why like every time I consider moving, I haven't done it is because I have a very, very good rheumatologist, and I cannot move. I cannot be away from her. So the energy, that's been my biggest issue.
Sure. And could you said that you don't know when you wake up how much energy you're going to have. Can you kind of give us an idea of what the range is? Like how long can you go before running out of energy on a good day or versus bad day?
Well, the weird thing is usually when I wake up and I already have I give myself enough time to have a slow morning to get myself started, but I've noticed that if let's say I wait until noon to really get started, it's kind of like the fatigue sets in, versus if at 10 I kind of get myself active, I don't get tired. It's really strange, but I try to set up my schedule so that the bulk of my activity is starts around 2. So during that time, I'm able to manage the things that I have to do to be able to make it through the day. A lot of it is also kind of mental preparation. So I kind of give myself pep talks about you need to do this, so you need to be able kind of talk myself through what I need to do to kind of make it easier for my body to be able to do them.
Sure. Thank you. So I know there's a lot of voices to be heard. I do want to explore some of the other symptoms that we haven't necessarily talked about as much. Thank you for bringing up Raynaud's. That was one of those, but I know we've kind of really talked about fatigue. To some degree, we've talked a little bit about the pain that you experience, kind of this full body pain. What other symptoms, for those of you that selected a top 3 most burdensome symptom, that was something else that we can explore a little bit? And we'll go right here.
For me is Sjogren's syndrome. Oh, I'm sorry. My name is Shannon Green. Hey, I have lupus. I'm allowed to forget some of these things. My biggest symptom for me is Sjogren's syndrome. The dry mouth, the dry eyes, especially this time of year, the leaves are blowing and so is the dust into my eyes. Or in the summer, it seems like the sun, once it gets that summer equinox in July, it just dries out every piece of moisture in my eyes. It explained, I'm being very transparent, explained my sexual issues in the past when I was told that I had Sjogren's. And just, certain water just doesn't satisfy you. Drinking soda, coffee, and tea will exhaust you later in the day. I just never knew that something as dryness could really change your life like that.
Yeah. And how long have you been experiencing that?
Oh, well, I was diagnosed with SLE in 2015. However, I developed rheumatoid arthritis in 1982. And I really do not believe that it was rheumatoid arthritis when I was 12. More than likely it was lupus, because I always had a rash on my skin. I always developed these, what's the word for it? where your eye swells up and things, infections in my eyes and what have you.
And the dryness of mouth, was that always there, or is that something you developed over time?
I thought I was just nervous because I'm shy and I don't like speaking publicly. So I thought my mouth was getting dry because it was my turn to say something, not knowing that it was probably dry all the time.
Yeah. Would never know you're nervous.
Oh, yes, very.
Yeah. Well, thank you so much for sharing.
Thank you. Thank
Yes.
you. Can I add one more item, please?
Yes.
Oh, then I won't speak for the rest of the morning. What worries me the most about my condition, my primary caregiver is 15 years old, my daughter Elizabeth, and she knows when I'm flaring before I do. Your cheeks are red. You're walking slow. Let me get that for you. And for those cans, the best thing out there is the electric can opener. It's absolutely fantastic. But I do worry about the children or the caregivers who take care of us because they see the progression. And it's so hard. Sometimes it's so hard for them.
Yeah.
So thank you.
No, thank you. All right. Again, we're trying to discuss some additional symptoms that have been most burdensome to you. We'll come right here.
Anita Love from Portland, Oregon. And I can relate to the Raynaud's. I got up and just got a cup of hot water to keep my fingers warm. It's really hard, like they say, in the summertime. For me, what was most unusual was one day walking in the house, and all of a sudden I couldn't walk. I'd lost the use of my legs. And I just so happened to have an appointment with my pulmonologist because for me it's my lungs, and I was in a wheelchair. And he goes, "Why are you in a wheelchair?" I went, "Because I couldn't walk. I mean, I drove here, but I wheeled myself, and somebody helped me." And I ended up being in the hospital for 5 days while they tried to understand why I could not walk. One of my biggest concerns about having lupus is I know for me it's heredity. I have it on my mother's side and father's side, and 2 of my children have autoimmune illnesses. So that's a real big concern, is your family and loved ones developing an autoimmune. I'm 64 years old, and I've had it for well over 20 years and probably longer. But for all of us, I think we all know that you need to adopt a model. And for me, I've taken the line from Lupus Fog, the movie with Leonardo DiCaprio, the Titanic.
Oh, okay. That one.
When they make the toast,
Yes.
here's to making each day count. And that's what we have to do, make each day count. Thank you.
Yeah. A question for you. The issue you described where you were not able to walk, was there first any kind of resolution to figuring out what that was, and also has it happened ever again besides that one time?
It only has happened that one time. That honestly, they could not figure it out. It took me about 3 days to regain the use of my leg. It was the first time ever being hospitalized and not being allowed to bathe myself because I was in a bed with an alarm. I think for women, when we're diagnosed with discoid lupus, it becomes a part of your beauty. And for me, mine was hair loss. I was first diagnosed by a dermatologist with discoid, and I lost my hair. So for women, when you start having to do, weaves and additions, it goes into just who you are. And when your whole life is more spent socially with monthly blood draws, every 3 months with the ophthalmologist, and that becomes your social circle.
Sure. Yeah. Thank you very much. I know we're working through other symptoms, but I would like to see, as we're working through people, I guess wave your hand, especially high if you have experience with skin issues, lesions of the sort. You could still chime in now, but just throwing that out there, we'd like to make sure we cover that as well. So.
Okay, thank you. Hello, I'm Ashley Grimes, and I'm from Montgomery, Alabama, if you can't tell. um, yeah, let me see, on the panel. I'm sorry, on the panel up there. Laura, I could relate to you. Wow. I too have a blood disorder from the lupus. My blood throws clots. The scariest point for me was probably a year and a half ago. I had a blood clot form in my aorta in my abdomen. They could not stent it. They could not do the angio on it because of the placement where it was near the kidneys. So I have been pumped full of blood thinners, blood thinners, blood thinners. Now I'm iron deficient, anemic. So now I go for treatments on that. But the biggest thing is cramping in my legs, the pain in my legs from walking. And you know, it's bad, like even to get here, I mean, I am so honored to be here. Don't get me wrong, it is a thrill, it's an honor. But just to realize when I was in the airport that, you know, I'm 46, 47, and I'm in a wheelchair. The lady beside me is like in her 80s. And I can't walk because my legs, the cramping, I don't get the blood to my legs. But I think I speak for everybody here with the Sjogren's. I feel you on every point. I'm glad you brought all that up. And for the drug people, I do have pictures. I take methotrexate, and I can actually show you pictures from an endoscopy to what some of the medications do to our stomachs. I have holes in my abdomen, and I bleed through my abdomen because of some of the medications. So if you would like to see them, maybe after lunch, I'll be glad to show them to you. And again, thank y'all for having us here. I hope that what we're saying will speak for so many of those that couldn't be here today, whether it was because they just couldn't or they're not with us anymore. So God loved them, and it's a sisterhood, brotherhood. We got to ride the storm together. That's it.
Yeah, thank you very much. All right. So can we come right here, and we'll move around. Sorry to keep.
Hi there. My name is Kelly Rosetta. I'm here from Molly's Fun Fighting Lupus, and I've had lupus since I was 11 years old. First diagnosed with juvenile rheumatoid arthritis, and then when it went to my kidneys and lungs, they discovered by a child rheumatologist that I had systemic lupus erythematosus. I think one of the main concerns for me in my life is the constant risk of infections. Because of our sensitivity to certain antibiotics with lupus, the sulfa antibiotics and things that we shouldn't take. I was in the hospital a little over a month ago due to just a normal stomach bug that I picked up from my 3-year-old little boy. And I was immediately hospitalized with kidney involvement. It went straight to my kidneys. I was given a very high dose of Solu-Medrol, and I'm still dealing with the ramifications of that. Even a paper cut to us can cause an infection. And that is extremely dangerous, particularly since we have such sensitivities to certain antibiotics.
And just really to understand how that has impacted your life. You know, how often are you hospitalized for an infection? Really, what has this looked like over the years?
Well, twice this year. And then I almost died after a minor surgery back in March because they did not give me a stress dose of prednisone when I was in the hospital. And that caused a adrenal insufficiency crisis. And before that, I mean, we're also having to deal with, too, anemia and blood clots and all these other aspects. Some of us have severe vitamin D deficiency, so there's all these different things, too, that are kind of working against us while we do get into crisis mode with an infection.
Sure. Yeah, thank you. Thank you for bringing that up. All right. We'll move here to the center of the room.
Hi, my name is Tiffany Peterson, and I'm from New York City. I wanted to touch on two things. First, the impact of lupus on our mental health. I think that it's not spoken of enough, and there aren't a lot of resources available. Of course, lupus can lead to depression, and if you already have depression on top of lupus, it's kind of even more severe. If you're on prednisone, you know how that affects your mood, so it kind of like amplifies that severely. In the past, I want to say in 2012, due to high doses of steroids, I ended up going into a steroid-induced psychosis, and that happened for, I think I was hospitalized for 4 months. Almost lost my life. But it wasn't even something that I thought was possible. And I think that's something that needs to be touched on, because anxiety, depression, those are things that are real. It's more than just being sad. You know, it's crippling, it's disabling, it's isolating. And the second thing I wanted to bring up was, I don't know if it's been discussed, but I haven't heard much on it, is trans health and lupus. I have had the amazing opportunity to meet some amazing trans men with lupus, and I think that's something that needs to be researched into, how hormones play into lupus and trans health.
Sure. So on the topic of depression, I know you mentioned the steroid-induced psychosis, but just more broadly talking about depression, anxiety, those mental health issues that you bring up, very, very important. Is that something that is a result of, you think, being socially isolated? We've heard comments about having to kind of cut off from work, job, schooling, social interactions, or is it, kind of just struggling with the identity of the disease? What for you, at least?
For me personally, it's struggling with how the disease has impacted my life over time. The things that, I can no longer do, the things that I've had to change in order to be able to move on. It also has to do with socializing when it comes to anxiety and just people not understanding what your needs are, or maybe your loved ones are not understanding, or they don't believe you, and so that can play a role into how you feel emotionally over time. I think that's been one of my biggest struggles, is my mother struggles with understanding. Sometimes she's really understanding, other times she's just like, you were just walking yesterday, like, what do you mean you can't wash the dishes? So it's simple things like that that kind of break you down over time, where you're like, am I overreacting? Like, am I really in pain right now? Like, you sort of question yourself, and that can be one of the most disabling things, when you don't even know who you are or what you're capable of.
Sure. Thank you, and thank you for sharing that. I do want to keep your hand in there if you do have something to share on skin issues, rashes. I'll come right here, and promise we'll try to keep hitting on more of these other symptoms, but want to make sure we cover this while we have a chance.
Well, I'm sure that my name is Ann Renfro, and I'm from deep South Texas, the very tip of Texas. I live right on the border. When they say you live on the border, we live right on the border. I'm about a mile from the border between Texas and Mexico and the Rio Grande. I'm very fortunate. I was diagnosed in 1980. I probably had symptoms probably 15 years before that. I struggled through nursing school, showing up for class, or for clinical, and getting notes for class, because I had hepatitis my junior year, and I had mono another year, and nothing was really associated with the lupus. I also have what's called overlap syndrome, so I have diagnosis of polymyositis, Sjogren's, Raynaud's, and scleroderma, and I like to think of myself as a success story. I am a nurse, went through nursing school, not diagnosed, but surely I had it. And I've had skin problems, but I'm fortunate, all my skin problems have been below the neck or in the hair. With the Raynaud's, when I had the polymyositis diagnosis, I had ulcers on the side of each finger, and one was gangrenous. They don't make a Band-Aid that you can really do, and being a good nurse, I know how to do good bandaging. I had to soak my hands 3 times a day, and I would soak them in whatever I could think of that might help. Digging your fingers into the purse to get your keys was excruciating. When they talk about heart disease and a heart attack or a myocardial infarction, they talk about it feels like an elephant standing on your chest. This felt like I had an elephant standing on each one of my fingers, except the thumbs didn't bother me as much. They were all ulcerated. The only drug that was, I had compounded drugs to put on my hands. I used nitroglycerin patches, creams. The patches I would cut up and they give you a headache if they're working. So I would put them on at night. And then when I'd get the headache, it would wake me up, so I'd take them off, and that would kind of get me through the day. And that was before I had the ulcers. When I had the ulcers, the nitro patches didn't work. They put me on medication, ACE inhibitors, I guess they used, didn't work. I had edema all over my body, but they didn't really help. And the soaking was with oatmeal, olive oil. Then you had to get the olive oil off so that the Band-Aids will stick. And then you had to cut up 18 Band-Aids is what I would cut up, and I'd wrap them this way and that way, and then I could manage. And at the time, I'm a nurse. I think I said that at least 3 times. Very proud of being a nurse. I had to leave working in intensive care because my fingers would have a skin lesion and then I'd get an infection. I worked full-time. I have 2 kids. I worked full-time for my whole career and retired early at 63 after working 25 years in the university. The only time I missed work was for my kids, maybe a little bit of a flare, and then the polymyositis. I discovered it at spring break. I was teaching at the University spring break. I had somebody help me grade my papers. I couldn't type, and I was teaching online. I was trying to do everything, I'd have the phone like this and talk from the phone because I couldn't, with the polymyositis, I couldn't move, and my hands were completely unusable. And I went back to work the next semester, not doing very well, but still managing. And so I think most of us do that. It's like you do what you have to do to get through the day, but when you have something that like completely debilitates you, it affects your personality, it affects your body image and your self-image. And I feel fortunate that what I've had has been very invisible, but it also is a price you pay. Many people have mentioned that. So when I had the Band-Aids, people knew there was something wrong. So I guess that was an advantage.
Are the ulcers still something that you struggle with, or do they ebb and flow?
Yes, in fact, I'm on sildenafil, which is Viagra, and it's off-label, so I had to appeal now twice. Once when I was doing my regular insurance, then I had to appeal when I went to Medicare because I turned 65, which has... So the drugs have to be reevaluated, and both times I was able to be successful with the appeal thanks to my doctor, who also told me that I go to the immune center at the University of Texas in Houston, which is 300 miles away from most of my health care. So I try real hard not to get sick. I lost my train of thought. But you had asked me what was the question.
You've answered it. I was asking if you still struggled with ulcers.
Yes, the sildenafil is off-label, and it's for pulmonary arterial hypertension, which I found out last week I might have. So now I'm on label. I guess that's a good thing. But the off-label, in lupus we have to resort to off-label medications. Medications that were designed for cancer treatment, medications that, this or that. We take a medication, the sildenafil, for example, for my hands, probably masked the symptoms of the pulmonary hypertension, so delayed its diagnosis. So there's really, I wouldn't want to have the drug companies problems.
Yeah. And we
Because
will
it is
definitely.
very difficult to find a drug that will help us with the symptoms, so it doesn't masks the other markers that we're using to keep track of the flares, and you know.
And I think
But-
we'll definitely have some more time to explore some of the approaches to treating these symptoms in the next session. So thank you
But
for
you can
sharing
get a
that.
prescription for Viagra, cut it in little
Yeah.
pieces, and then it's only $30 a day instead of $100. So.
Okay. So I know we're still covering some burdens, so I want to see right now if there's anyone that has had anything that we haven't yet talked about at all. All right, we'll go start in the back. And next, just for our mic runner, we're going to go to the far back next. So.
Hi, my name is Lourdes Dillon. I'm from New Jersey. How I got to discover I had lupus was through my skin. I had a lot of issues in my skin for many, many years. I would develop a lot of infections to metals, to anything I touch, and dermatologists, you would assume I was just allergic, very sensitive. I kind of have to force my doctor to do the test, to run all the tests so they could get a diagnosis for me, and that's what happened. My dermatologist finally found out I had lupus. I also have Sjogren's and RA, and I am now, the reason I'm here today is because nothing has worked for me. I am always have to wear special clothing. I'm not able to be in the sunlight, not even a minute. And I don't want to cry. I haven't been able to drive or be outside without covering for more than 5 minutes for a long time. SPF doesn't really do much for me. I develop a rash that is painful and just unbelievable, itchy. I can't get out of it for weeks. If I'm by a window and I get sunlight, my fatigue increases 300%. So I am still able to work. I kind of from home, but I am just kind of tired of having to cover all the time. That in itself is a whole different thing. Like she was saying, with the mental process, it affects the way you feel. You want to be normal. I have a daughter that had to stop doing sports and things like that just because I couldn't be there for her. It's just really hard, and I've been battling the disease for over 9 years since diagnosed, more or less. I think I tried everything there is to try, including everything topical. And just last year, I found myself in the emergency room after traveling to look at colleges with my daughter, and prednisone did not do anything for me. It actually got me worse. That was the miracle drug for me. It got me into the emergency room. And ever since then, I just got tested positive for like 27 different allergies of things that I didn't even know, even clothing, like something that's not common. But anyway, I now don't know what route to take.
Sure.
I don't know what to do or where to go. And that's where I am today.
Well, I
Thanks.
appreciate you sharing your experiences. Hopefully that'll drive us to a place where we'll have options for you. So we're going to take one last comment in the back before we break, but just so everyone knows, there is definitely more opportunity to share in the context of our afternoon discussion. So, yes.
Hi, I'm Ashley Suter. I'm from West Virginia. I'm 29. I was diagnosed in 2010. One of my biggest symptoms has been gastroparesis and GI dysmotility. I'm stuck on TPN, which is IV nutrition, and I actually know a lot of lupus patients with gastroparesis. I know it's typically associated with scleroderma, and I have a lot of doctors that have been like, do you have scleroderma and not lupus? And it's been really debilitating for me because I'm stuck on TPN 16 hours a day. I'm hooked up to a pump and I have to carry a backpack around. So that's been one of the biggest problems, and I can't really eat anything or drink much of anything, and I have a G-tube, and it's a big problem. I mean, I have a lot of really debilitating symptoms, including CNS lupus and just autonomic dysfunction in general, but this has been one of the biggest problems I have, and that's not really talked about much or really known much in general. So that's one of the biggest problems that I have.
Sure. Thank you so much for sharing that. Sure. So that concludes our discussion of the topic 1 questions related to the burdens and symptoms of lupus and their impacts on your life. We're going to reconvene in the afternoon to build on that discussion, really to see the approaches that you've tried to manage these terrible symptoms and burdens that you talked about already this morning. And certainly, for those of you that haven't had a chance to speak, I want to encourage you to, share in the afternoon. Obviously, every treatment approach, there's a reason for that, and that's the lupus. And so I think there's still going to be an important conversation and hear more perspectives in the afternoon.